briefly.
My view would probably be a little different from a lot of folks, but I actually would like to see women do it as early as 35.
Okay.
That's not going to have sweeping acceptance at this point, certainly from insurance companies. But certainly at menopause, a woman does need to get a bone density test. Now, if she has low bone density, she does not know when she first takes that bone density whether or not she's presently losing or she never gained the bone mass. So in other words, you take a bone density, you know, you have low bone mass.
Sure.
Is the woman currently losing, or did she never gain bone mass? And here's a good example of that. Over 50% of the bone is put on the bones in our teen years. When we think about how teenagers, particularly in this country, eat or diet during their teen years, they're not going to be putting on that bone mass. And I think in my case that was the case. I was not eating properly. I even smoked. I smoked from age 12 till 20. So I think that by the time I reached 35, which is when I should have my peak bone mass, I had never gained it.
Wow.
So now at menopause, I cannot afford to lose the 10 to 20% of bone mass that a woman will lose over that five-year period. So that's why a woman needs to take the bone density. Now, if a woman were, say, to lose that much, again, 100 years ago, women were dying between, they say, 60 and 70. It didn't matter so much. Well, it does matter now because women are living longer. And by the way, this is not just exclusive for women. Men are something, I think it's like 1/3 of all the hip fractures are occurring in men. And my next door neighbor just a month ago fell at 72, broke his hip.
Well, I think we hear a lot about this, bone density test, just for women, mainly osteoporosis. We hear about osteoporosis for women, but I know it's even prevalent in men too, isn't it?
Absolutely.
See, we just think about women when we think about osteoporosis. I want to talk about bone density as far as the procedure. Can you explain to our viewing audience, what the procedure is? Is it some people say, well, I don't take no bone density test. I don't want to go through all of that. Can you explain the procedure just a little bit so they know?
Well, there are a lot of different ways to take bone densities, but the best way right now that we have, and the gold standard really is called a DEXA, which is dual energy X-ray absorptiometry. But if people just remember DEXA, that's all they need to know.
Okay.
And they should be getting a low back and a hip. Right now, sometimes you've probably seen at Long's drugstores, they offer a wrist for like $25, and those are great. They'll catch the real severe osteoporosis, but what I say about that is that if it's high, you need to do the hip and the low back. If it's low, you need to do the hip and the low back.
Okay.
So you can't follow a patient with that, with the wrist. Also, ultrasound is gaining interest of the calcaneus bone, which is the heel bone.
Heel bone, right.
And I don't recommend that either because, again, you can't follow a patient with that. It varies, and even they say, well, if you have a -1 standard deviation or above, which is about 12%, you still have to do the DEXA.
Exactly.
See what I'm saying?
Right, exactly.
Yeah. So
now I'm going to talk about estrogen and breast cancer. I understand there's a big correlation between estrogen and breast cancer. What have you found out about that?
We could do a whole show.
I know we go on forever on this one. I realize that. Just briefly.
Okay, well, estrogen, there are many different types of estrogen that the bodies produce, but to keep it simple, estradiol, which is one of the principal, and estrone, two of the principal estrogens that the body produces, will push tumor growth, will add to cancer production in the body.
Okay, let me just stop. So in other words, taking estrogen externally in the body will produce these other two hormones that you have just mentioned. Is that correct? Or am I?
No.
Say that again.
Our own bodies produce many types of estrogens.
Right, okay.
And the two that we know will push cancer growth are estrone and estradiol, which are the two, okay? Now, estriol, which is another one, is what a woman produces significantly when she's pregnant.
Okay.
And that's the one but when women are offered Western medicine, estrogen, it comes in the form of Premarin, or there are other forms of estradiol, which is the one I was just talking about. Okay. Sorry, everybody. I know this can sound a little confusing, but I do want to make a couple points here. Premarin comes from the urine of pregnant horses.
That's what I heard.
If you break the word down, PRE, pregnant, mare as in horse, IN as in urine.
That's what I heard.
You know, we don't really need to be corralling horses for their urine. I mean,
Yeah, right.
I don't really think we have urine deficiency. So I think that that's not the way I would recommend women take estrogen, because what they're after in the Premarin is the estradiol. And you can even ask her, if a woman today is on Premarin, she can call her medical doctor today and say, I want to switch over to just plain estradiol. They usually won't have any problem doing that. It's just that they're so used to offering the Premarin.
Okay, I understand.
Okay.
Totally understand.
Yeah, and estradiol is made from soy. It originates in soy, and they manipulate it to become actually our very same estrogen.
Very simple.
Yeah.
What I want to do right now, doctor, I want to go ahead and give the health tip of the week, and then we'll come right back to the show, and we'll talk more about these problems, menopause problems, and estrogens, and all these particular hormones. I just want to give the health tip of the week. And the health tip of the week is going to be Parkinson's disease. And I'm going to explain a little bit about Parkinson's disease. Health tip of the week, Parkinson's disease. You know that Parkinson's disease, there's an interference with a nerve in the neck that can aggravate these particular symptoms like tremors and speech deficiencies, and can aggravate these symptoms a lot and maybe make them more pronounced. And you know, by taking the pressure off of those particular nerves in the neck, it can decrease these particular problems with the tremors and the rigidity that's in Parkinson's disease, and also the speech patterns. You know,